So let's go through how to navigate the epic hyperspace and do an effective and hopefully an efficient chart review. So if it's a follow-up patient, really all you'll need to do is identify when your last visit was with them. So in this case, it's a test patient. So my last appointment with them, scheduled was in January. So not much has happened or transpired since the day that I'm going to see them, which is tomorrow. I could click on these to see like what orders have been placed since. Uh, and yeah, I guess it's also important to note that I'm going to be on the chart review tab. I would have already pre-started the visit, even though they haven't yet arrived. However, if it's a new patient, then that's where the chart review is probably going to be the most important. So you have an open pane here, and then on the left-hand side, you also have another pane, and then within that pane, you have a couple of reports. You have a regulatory, you have medical history, and you have clinical. So the regulatory gives you kind of the rundown of the patient as far as their active insurance. It also here you will see the referral. In this case, it's again a test patient, so you won't see that example. But usually there's a referring physician listed. It will say there'll be a referral number which is hyperlinked, and you can click on that. It'll take you directly to the referral, and it'll also give you the date that referral has been placed on. In this instance, you don't see that. So one option that you could do is you could go to referrals and you would look at the date that the referral was placed. Typically, it will say rehabilitation services or something of the like, and that is where you click on the appropriate referral. So we'll use this as an example. You would scroll down. You'd say it's referred by, the department, and it's referred to. It would be physical therapy rather than hepatology. You'd scroll down. There'd be referral notes in there. There'd be an ICD-10 code, and then noteworthy would be that you would identify the date that this referral was placed, and that would help to cue you in as to when you wanted to start your chart reviewing. So then I would go back to encounters. I would navigate to that particular date, and hopefully that particular encounter that has the referring physician listed. And I would click on that. Like, for instance, maybe it was the primary care visit. I'm going to move this off to the side, but not all the way. And then I can kind of review the note that was the referring physician note from that encounter. Another thing that I often do is I'll identify all the relevant encounters that they've had leading up to my appointment, leading up to the appointment with me. And in so doing, I will click this button, which displays in my sidebar. And you'll notice that now it says reports and the visit report, reports, and then the visit report, which is just a preview of this current note. I could then click on another note, maybe it's this referral, and I could do the same thing, and I would pull that over. So I'm populating kind of a index library on this right-hand pane that when I go into my actual note, I would be able to pull from this information rather than flipping back and forth between the chart review and the notes tab. Other sections within the chart review that are noteworthy, if they're post-operative, oftentimes the operative report, almost actually always, the operative report won't populate under their chart review encounters. You would need to go to notes, and then you would need to navigate down to their procedural note. So one way that you could navigate that is you could click on a filter of procedures. Loaded data did not contain any quick values, right? So that there was no previous procedure, so that's not going to work in this instance. And then you can see that I have open notes that I've used for this patient as examples that weren't shown, like in the encounters, right? It only shows my appointment for tomorrow, but here shows the open notes that I have as I was just using this test environment and this test patient to exemplify the notes previously. But this would give you some additional granularity as to notes that may not populate within the encounters tab. Additional things that may be of noteworthy would be any ED visits. Sometimes those will populate in the encounters. And then if you want to look at their labs, that would be potentially noteworthy, especially I guess I predominantly look at their CBC and their metabolic panel. And that just gives me an idea of their healing propensity, as well as maybe other comorbidity risk factors that may be relevant for us. And then beyond the referral tab, I also click on the RAD tab, which is our radiology. And this is where I could click on this and see the report. Typically, the report would populate here. The reason why it doesn't is you can see the status of this is pending in the future or ordered. None of these have been done, just given the practice patient environment that we're currently in. I will also often click on their patient IQ tab. I don't believe you'll have that, so you'll need to open that up, as we previously discussed, in a actual browser. And so you just navigate to patient IQ login. You can see the URL there, and then you would log in under the username and password that we provide. Other relevant information would be demographics. So you can navigate there in two different fashions. If you have the demographics tab there, you could click that, or you could click their picture. That navigates you to the demographics already. Why is this relevant? It gives you an idea as to how far are they traveling. It also gives you some information about potentially about their employment history. And though they offer a lot of this, the patients offer this a lot in the patient IQ intake form, but say they hadn't done that, then you could also click through this information and look at their social history and otherwise to get an idea. So on active military duty in this case, but this gives you information that would otherwise be relevant. Their contact information, specifically their email address and their phone number, would be relevant because you'll need to utilize that when sending off their HEP in the WIBI portal, which is the exercise portal that we utilize. The final element that is probably going to be important in some instances is this little E. Stands for everywhere, so care everywhere. So Epic healthcare interfaces with different healthcare services. So maybe they're getting care beyond just Stanford Healthcare. Typically, we see people at Sutter Health as well as at UCSF up in San Francisco. Here, you could see additional encounters, documents, labs that may not populate may not populate under this. Sometimes you will see it, and it will have like this E symbol in this column here, indicating that that was not done at Stanford. But you could also get potentially a little bit more information and granularity by clicking on the Care Everywhere tab, and that opens up the additional documentation from those different encounters. But for the most part, that would be where you would probably the most common tabs that you're going to click on in order to and to get all the information that is needed. I will say that I do see a decent amount of post-ops in those cases. Under the media tab, there are instances where our sports medicine department will upload precaution face sheet, it's called, where they'll check off the weight bearing status and the range of motion limitations and precautions. Specifically, Dr. Seth Sherman's office does that a lot. I don't know how many of the other physicians do that. Oftentimes, they will put that, I know, either at the bottom of their surgical or operative note, or in their first post-operative visit note, which is usually done with the PA. On the side panel, or just orienting you to this, so you'll see their primary care, you'll see the referring physician information, and then you also see the height and the weight of the individual, which can give you a thin slice as to what to expect, just on how they will present anthropometrically and otherwise. Okay. Otherwise, that is kind of the sequential chart reviewing recommendations that I would have at this time. Feel free to find your own workflows and go from there.